Over the last 24 hours, we have identified 479 new cases of COVID-19 and completed about 10,800 tests. This puts our positivity rate at about 4.7%. We have identified 50 new cases of the variant of concern. About 11% of our active cases are currently variants of concern. Looking to schools, there are currently active alerts or outbreaks in 283 schools, or about 12% of all the schools in the province. Currently, these schools have a combined total of 1,199 cases since January 11th. There are 262 people in hospital for COVID-19 treatment, including 44 admitted to the ICU. Sadly, I must announce that 4 new deaths were reported to Alberta Health in the last 24 hours. My condolences go to the family, friends, and loved ones who are mourning these individuals. We have now administered more than 397,500 doses of vaccine in our province. I want to thank Albertans for their patience as we book appointments. We are dealing with a supply chain that sometimes changes quickly without warning, and we are working to get doses out as quickly as possible. This means that sometimes there will be minor changes when unexpected events occur. For example, a shipment of Moderna vaccine that was set to arrive in Alberta earlier this week was grounded outside the province due to mechanical issues on an airplane. As a result, this has delayed the shipments to 43 pharmacies, which will get their vaccines a few days later than expected. We understand that these sorts of delays are frustrating, and we are delivering the vaccine as quickly as possible once it arrives in the province. We do still have appointments available, though, and tomorrow AHS will open bookings for the next 3 birth years in Phase 2A. Albertans born in 1952, 1953, 1954 or earlier, and First Nations, Métis, and Inuit people born in 1967, 1968, 1969 or earlier will be able to book online or through 811. Bookings for this new cohort will begin at 8 o'clock tomorrow when the tool comes back online. Pharmacies continue to book appointments for everyone born in 1956 or earlier. Please be patient, as all pharmacies and Alberta Health Services teams are doing the best they can to book as many Albertans who are eligible as quickly as possible. Our current variant cases, the vast majority, particularly the B117 variant in particular, is being spread in our communities. As in the example I shared today and many other examples that we're seeing, the B117 variant is spreading in many different contexts and many different settings, and we're seeing higher attack rates than we typically do in settings where people are exposed. Thankfully, so far, our P1 variant cases and the B1351, those 2 variants are the ones originally identified in Brazil and South Africa. The cases that we've seen so far of those variants have been very small in number and linked to travel. But the variant originally identified in the UK, that variant has become established in the community. While we are continuing to work hard to slow its spread, it is spreading in all zones in our province. With respect to moving forward with further easing on step 3, one of the things that is really critical to consider again is that we are starting to see in other places around the world, such as several countries in Europe where the B117 variant has become dominant, even in places that did have a very high second wave, that they are experiencing a very significant third wave, which includes a spike in deaths. We're seeing other provinces in Canada that are seeing rapid acceleration of cases, and we need to make sure that we are watching closely other jurisdictions and considering all of those factors in any potential easings and moving forward, given that, again, we are in this very critical time where the variant is rising and we don't yet have enough vaccine on board to protect those who are most vulnerable.